I felt like I was trapped in my own little house and everyone was far away. Those were words uttered by a 14-year-old girl, her name Aya Raji, as she stated these words to a New York Times Review interviewer last November. Lately, I've been mad all day. Little things make me mad. I'm angry for no reason. I don't know if it's COVID, said another teenager last fall. Those very raw words paint a dire picture. The social isolation of the pandemic, on top of a year of racial strife, has taken a uniquely harsh toll on the well-being of our young people. Good afternoon. I'm Michelle Williams, Dean of the Faculty here at the Harvard T.H. Chan School of Public Health. And it is my great pleasure to welcome you to today's incredibly important town hall event, Adolescent Mental Health in the Time of COVID. This event is presented with the National Alliance on Mental Illness, NAMI, and with support from Google Health and YouTube. You know, even in the best of times, we have failed to adequately address the mental health needs of adolescents, with rates of anxiety, depression, and suicide steadily rising over the last 5 years. No one is immune to the psychological toll of this pandemic, but the truth is, children are uniquely suffering in ways we've barely begun to grasp. Isolation, depression, loss of sleep, loss of appetite, the rise in self-harm. We saw a 31% increase in mental health visits to emergency rooms by 12 to 17-year-olds in 2020 alone, proving that this is nothing less than a crisis. It is therefore my hope that we will all come to terms with the fact that our mental health is as important as our physical health, and that we can't have one without the other. Conversations like the one we're having today will continue to help destigmatize mental illness and will allow for us to more willfully provide the support we need to improve mental health for all. I'd like to now turn over this podium, the virtual podium, to Dan Gillison, the CEO of NAMI. Dan, over to you.
Thank you, Dean Williams. Good afternoon, good midday to those in the West. I'm Dan Gillison, the CEO of NAMI, the National Alliance on Mental Illness, the nation's largest grassroots mental health organization. It is our pleasure to collaborate with the Harvard T.H. Chan School of Public Health in our mutual efforts to increase understanding of mental health during these challenging times. May is Mental Health Awareness Month, and every year, NAMI works to raise awareness and reduce the stigma surrounding mental illness. Throughout the month, we also recognize specific aspects of mental health, and this week is Children's Mental Health Awareness Week. That brings me to the topic at hand today, youth and young adult mental health in the time of COVID-19. It's no secret, our young people are not all right. From isolation to virtual learning to being cut off from mental health services, the well-being of our nation's youth has been tested. Students across the country are dealing with the pressure of the pandemic. In the fall of 2020, a study showed high school students were more stressed about school, getting less sleep, and said their relationships with friends and teachers had decreased. And 83% of those students reported at least one stress-related physical health symptom, from headaches to exhaustion to difficulty breathing. Last June, a CDC study showed that about 40% of US adults were reporting at least one mental health or substance use concern. What you may not know is that when it came to young adults, ages 18 to 24, that number jumped to nearly 75%. 75%. Think about that number, 75%. It means if you have 4 young people in a group, that 3 out of 4 have been impacted. We have also seen a sharp increase in the number of ER visits by people under 18 related to mental health concerns, as Dean Williams mentioned. In a time when going to the ER was a dangerous proposition, parents had no choice because of the severity of the concerns or the lack of access to their normal sources of care. The data is clear. We must help our youth and young adults now and as they transition to the future. Despite schools beginning to open and vaccination rates increasing, we know this crisis is not over. The trail of trauma is a long one and cannot be ignored. We hope that today's candid conversations will bring these issues and the solutions we need to light. Thank you again for joining us. Thanks for all that all of you do. And Dean Williams, now back to you.
Thank you so much, Dan. And now it's really with a great privilege and pleasure and honor to welcome our moderator, Juju Chang, who is co-anchor of ABC News Nightline. Welcome, Juju, and thank you so much for being with us today.
Oh, thank you, Dean Williams. It is actually my honor and my privilege to be with you today. And thank you and Dan Gillison of NAMI for your leadership in this incredibly important topic. And thanks also to all of the supporters out there, but specifically of this event. Google and YouTube have been tremendous supporters. It's not only my pleasure to be here today, but it is quite clear that we are seeing warning signs that this is a monumental conversation about adolescent health, mental health, and healthcare. I have 3 essentially adolescent sons myself, so I know firsthand the impact of the pandemic. I live and I breathe these statistics that Dan Gillison has pointed out. All of us are feeling this strain, the trauma and the toll that comes with more than 500,000 deaths in this country from COVID-19 and a full year of isolation, of online learning and closed schools, of lost jobs, and the severe uncertainty of the future. That has had a tremendous impact on this country, not to mention the racial reckoning that has been ongoing and spilling out to the streets of cities and towns across this country. Add to that the fact that the pressure to achieve, even before the pandemic, was intense for adolescents. And even now, the impact is even more pronounced in the statistics that Dan cited, the sleeplessness, the stress, and the fact that physical ailments are now plaguing young adolescents. We have so much to talk about today, but before we begin, for all of you watching, we invite you to submit questions via Facebook at facebook.com/Harvard Public Health. I also want to welcome some students who are joining us today. They are adolescents joining us with permission from adults. I want to welcome you all. And also joining us is Dr. Christine Crawford. She is Associate Medical Director of NAMI. Archana Basu is Research Scientist here at the Harvard Chan School of Public Health. And Garth Graham, who is the Director of Global Healthcare in Public Health at Google and YouTube. Welcome to you all.
Having us.
Thank you. Great. Well, let's begin with you, Christine. From what are you seeing during this pandemic, just about how bad it is for adolescents out there?
Yeah, so at the beginning of the pandemic, what we saw was a lot of kids having anxiety about COVID-19 and the impact that the virus, the illness will have on their friends, their family. And there was a lot of uncertainty about what school would look like and how everyone would be safe. And then as time went on, because these kids were stuck at home, they weren't able to go to school, they weren't able to access the outlets that they would typically utilize to reduce stress, to improve their mood, were gone. And we saw a worsening of some of those symptoms and also people feeling really trapped within their home, not being able to talk to their family members, just not having the appropriate outlets. And so what I've seen in clinic over the course of the past year is that because kids are experiencing these really difficult emotions, these challenging internal experiences, and they don't necessarily have the language to describe what it is that they're experiencing, we could see kids having some difficulties with their behaviors, possibly acting out, being defiant, angry, engaged in destructive behaviors, which has resulted in an increase in some of the emergency room visits that we've been seeing, because the field of child psychiatry as well as child psychology has just been inundated with referrals over the course of this year. And there isn't enough of us to provide care. So that left these kids and the family members and caregivers of these kids to bring them into the emergency room. In addition to that, because for a lot of kids, having a sense of certainty, structure, and routine is really helpful. For some people, doing things that make it seem as though you have a sense of control over your emotions is something that we saw. So sometimes kids would engage in self-harm behaviors or engage in restrictive eating because that was something they were able to control. And it was a way in which they were able to cope with all the difficult emotions that they've seen. So it's just been interesting to see how things have evolved over time.
When the world seems out of control, I could imagine. There are so many warning signs, Garth, that we are seeing. You are the director of the global head of healthcare and public health at YouTube. Clearly, there's a lot of interface that your platforms have with young people. What are you seeing?
So, Juju, it's pretty dramatic. You know, surge interest in anxiety has reached an all-time high in this past year across the United States. Last month in the US, in April, we saw spikes in fatigue-related Google searches, and people are asking the question, why do I feel bad? That question actually reached a record high. So you think about some of the emotions and the things that people are looking for solutions for. But interesting enough, over the past year, we've also seen people who are looking for solutions from different sources. So we've seen an increase in searches related to meditation, virtual therapy, walking, and digital detoxes. So what you see are people searching for answers for what they're looking for, how they're feeling, and then looking for solutions as well.
Clearly a lot of real-time problem solving going on. Archana, you're a child clinical psychologist at Mass General Hospital, as well as a research scientist at the Chan School. Why are these challenges so intense for children right now?
Yeah, I think part of the answer lies in the fact that we're not just, the pandemic is multifaceted. It's been a prolonged stressor that has really impacted every aspect of how we live, interact, attend school, work, how we relate to each other. There's really not a part of our life that is unaffected. And as Dr. Crawford mentioned, typical supports, typical interactions and, social outlets, after school activities, those very normal spaces and opportunities for socialization have not been available in the same way. But on top of that, I think it's actually been a fairly complex landscape of experiences because in addition to the isolation and unpredictability, we know that losses, both big and small, including loss of loved ones, the economic impact on families as a whole, as well as social and political unrest, protests related to racial injustice. There's been a lot of really powerful and important experiences in this past year. So I think part of the answer is that this is a very complex landscape of experiences. And I think the other element is that developmentally speaking, for young people, teens and young adults, this is a time when teens and young adults are starting to explore their own boundaries, their own sense of identity. They're starting to think about, what they might do after school, what kind of, whether they might go to college, who they're going to be, who they're going to work with, what kind of relationships they're going to have. Transitioning from having a family of origin to a family of choice. And that kind of capacity to explore and kind of figure out who you are, your own sense of identity has definitely been affected by the unpredictability and isolation. So I think the answer is that it's, both has been very complex, as well as the fact that developmentally it has a unique impact on young people who are trying to, become more independent and kind of identify who they are as people.
Absolutely. I mean, clearly, this is a formative time for these kids. Christine, I'm curious, there are so many warning signs out there, but what gets your attention?
The things that I tend to worry about is when a child, an adolescent, is having difficulty functioning. What that looks like for a young person is difficulty attending school, difficulty maintaining relationships with friends and family members, as well as difficulty maintaining themselves, being able to get out of bed, having difficulty eating, having difficulty showering and taking care of their personal hygiene. If we start to see those core things fall by the wayside, then I'm really concerned. It's typical and normal to experience anxiety during these uncertain times. But when it starts to get in the way of your daily activities, that's when I start to worry.
Absolutely. Now, Garth, I want to turn back to you. I know my 3 sons play a lot of video games. I only learned in preparing for this that that's called comfort content. They've been doing a lot of comfort content. But I also know that YouTube is a first point of contact, therefore, with adolescents who are struggling with mental health issues. How do you assess this surge? And what kind of resources do you think has YouTube provided to address the pandemic and beyond?
Yeah, so we have been taking this issue of mental health particularly seriously because we know people come and engage on the platform, just like you articulated. In fact, we've been doing a lot of work with NAMI to help educate our creators and the folks who have influence on our platform. But one of the things we've also done is we've upgraded the visibility of solutions. So for instance, if you put in depression, you will see a text box come up right away that shows you both, solutions in terms of hotlines, but also ways you can text and get help. So really trying to connect people with help, especially if they're particularly worried. And the thing to understand is, the YouTube creator world is also a resource here because folks can create engaging content to reach young people, like folks in your family, folks in my family, in the ways that they understand and relate. And part of it is reaching folks, again, in their community, in their own context, in their own lexicon. And so that's the ability of platforms like us is to use the science and the interventions that we know about, much of what Dr. Crawford has spoken about, and then make them engaging so that people relate, and then also demystify this issue of mental health and remove the stigma, remove the barriers, remove all of those things that might stop people from seeking help.
You mentioned kids getting help on YouTube. Can you give us some examples of specific programming?
Yeah, so there are a lot of our creators who have made the kinds of content that kind of reach communities overall, a lot of different communities. So for instance, there's a creator called a channel called PsychHub, and it's a psychologist who has worked and talked about his own personal struggles with mental health, and again working to destigmatize that, but then also talking about collective ways in which people can both seek help and then think about therapy and things along those lines. So really, our creators are our source for how we contextualize information and reach people. So there are a lot of those kinds of examples on the platform. And then last year we did a lot with names and the kinds of names that people are familiar with in general to try and destigmatize the process, the concerns that people might have around seeking help, the process for looking for help for mental health challenges.
And Garth, how do you articulate YouTube's role now and moving forward in serving kids?
Yeah, so I would say in general, our role as a platform is to be able to deliver information to all communities and to be able to reach communities. Certainly, there's a lot of different kinds of things people come to YouTube for. When they come in, they look for information around health, public health, things like mental health challenges, to be able to surface the information that is beneficial and helpful to communities. One of the things, Juju, that is in particular to my role is, I spent a lot of time in practice of clinical medicine and in the healthcare industry. And what I often say is, gone are the days when people were looking for help with flyers and billboards. Now people are looking for help in the palm of their hand. They're not waiting for you to drop off a mailer. They want to find solutions now, and that's where platforms like ours can respond and create engaging information that takes science, the evidence out of the silos, out of textbooks, and into people's hearts and minds.
And as a clinician, we also have been educating ourselves about what is available through apps and online, and we're sharing that with our patients as well. So I've been doing my best to keep up to date about what's happening on all these various platforms, because they are incredible resources for our young people.
Absolutely. And there are apps, as Garth mentioned, like guided meditation and others. It's ironic that we go to our digital devices to help us detox from our digital devices. But listen, we all know that adolescence can be a lonely time, and high school can be a very lonely place, filled with all sorts of emotional struggles, even in the best of times. And yet during this pandemic, let's face it, all bets were off. So I want you guys to meet 17-year-old Jordan from Las Vegas and 17-year-old Marcus from North Minneapolis with a little look at their lives.
My lowest point in my life was my 6th grade year, and I get bullied. I was just so upset with the world and just mad. I just did not want to be there in life. I suffer with depression and anxiety. It feels like there's a dark hole traveling inside of me, and that I'm alone and I don't get to hear anyone, and that I'm just stuck. The pandemic affected my anxiety and depression even more, because it really felt like I didn't have a safe place to go. I was already uncomfortable talking about my mental health. It felt like something to be embarrassed about, something that doesn't really matter. It was tough being out of school and away from the things that I loved. Those were the things that shaped me and made me feel strong and loved. I really thought it was going to be the end of my life.
My anxiety and stress began after the killing of George Floyd. The product of that event was many riots and a spike in crime where I live. The place that I live is fear. Looking outside the window, fear of hearing different sounds around you, walking down the street, or fear while you're in your house. What helps me suppress this fear sometimes is my fitness or writing. During the pandemic, with all the extra time that I had, I began writing on what was happening and how I was feeling. When I write, it's kind of a way that I get to tune everything out and to be in a space of my own. The power of my words make me feel more compelled to write, and that my words matter.
Well, Marcus and Jordan, your words matter, and we hear them loud and clear in this moment. Marcus, when you say the place that I live is fear, it just gets you right in the soul. I want to welcome you to this conversation and first start with you, Marcus. You live near Minneapolis, where we know the Derek Chauvin's trial, George Floyd verdict just happened, and Dante Wright was recently killed. There is so much strife still. How are you doing with all of it?
Very, very stressed, exceedingly stressed, to say the least. It's the products of these events are very catastrophic with crime, and where I live, as I stated, where it's becoming just outlandish by the way that so much of it is happening and how it's happening so often. And it's hard to find a balance between trying to process it and consuming it as well, because you see it everywhere. You see it on social media, you see it on the news, you hear people talking about it around you. It's the topic of all conversation. And you go outside to see demonstrations of protests and riots and looting, and it's exhausting to take in and unbearable to talk about.
I appreciate you sharing those thoughts. And as a journalist, I know that it does at times feel just oppressive and overwhelming. Jordan, I want to do a check-in with you. How are you doing?
First, I would like to say that I'm honored to be here and that I get to speak out about mental health. I'm doing all right today. It's a really touchy subject to talk about, especially dealing with mental illness my whole entire life. So I have been dealing with it this week mostly, just trying to battle through the punches by writing and taking lots of naps to make me feel better, but just mostly focusing on myself so that I can feel a little bit better.
I also want to point out that joining us in today's conversation is John Anzalone, Jordan's principal at Sierra Vista High School, and also two incredible NAMI ambassadors, Corinne Fox, who is an actress and a producer, as well as Asia Mayrock, who is a poet and an author. And we'll get to all of you in just a second. But Marcus, Jordan mentioned writing, and you mentioned it as a means of coping as well, given all that's around you. Tell us about the solace that you find in the written word.
It's kind of a way for me to take whatever I'm feeling and whatever I'm thinking, whether it's perpetual or in a certain instance, and to be able to project that onto paper.
And you're a published writer. Can you share some of that with us now?
Yes. So this is the most recent editorial that was published by the Star Tribune, the local newspaper in my city, in the state of Minnesota, titled "I Live in a Cemetery Called North Minneapolis." And it states, "It seems that there is no one to turn to for safety. It feels like my death is already written on the sidewalks here, as if I have an hourglass above my head, monitoring the time I have before my life is taken. It seems as if all hope is lost. If I remain living here, it may cost me my life."
Well, those are profound thoughts and obviously some dark thoughts. And yet at the same time, when I asked you to talk about your writing, a big smile came across your face. And I wonder if you can help us understand why writing about your feelings helps you so much.
It's something that just gives me unexplainable joy. I think writing about anything, but most importantly, writing about what it is that's happening around me, only because it has so much emphasis on my mind and it weighs so heavy for me at this time. And so I took the opportunity to write about how I was feeling and what happens, and kind of put the audience, or for informative purposes. My writing is more for informative purposes, to help everyone to visualize the reality that is North Minneapolis every day, and how it is for me, and the feelings surrounding those things.
It's a call for empathy. You're calling for, it's radical empathy that you're calling for. Jordan, I know you're a writer and a poet too, and in one of your poems you wrote, "Where is the freedom? It all starts in the classroom." I want you to comment on that, especially since the classroom has been shuttered for so many American children this year. Do you feel like freedom is in your reach?
In terms of my mental health, I do feel like freedom is within my reach, because I did take that step to go get help for myself and say, hey, this is not how I should be living. People with mental health really think that this is just the way you're supposed to be living. That's not how you're supposed to be living. That's not living. That's just moving forward with your life and accepting. There's a difference between accepting for the better and accepting for the worse. And I accepted for the worst for a long time, not really saying, oh, well, this is my life. I got to just move on. Depression, anxiety, everyone has it. When in reality, people don't suffer like that. People want to go out and not worry about the consequences all the time. Now, I know that as a teenager, I want to be adventurous, and it really does stop me from doing that. So within those terms, I do think that I have freedom in my reach.
Incredible. Asia, you are a fellow poet. Can you speak a bit to the power of the written word and what we just heard Jordan and Marcus express?
Yeah, absolutely. So I got into writing. I dealt with bullying from the time I was 8 until I was 16. I used to have 2 speech impediments and a learning disability. And I didn't really tell anyone what I was going through for all of those years. I don't think that I really had the language to talk about it. And I also felt like it was my fault. And so I just stayed silent. And for me, writing was similarly that place where I was able to really feel all of the layers of what I had been suppressing for all of those years. I think sometimes we can feel that depression or anxiety, but not really what exists underneath that. And so for me, writing was that place where I could explore that and also find a sense of purpose when I felt like I didn't have a purpose and I didn't really want to go on.
Corinne, I saw you nodding your head throughout so many of the thoughts that were expressed now. Where do you come in on this?
Well, first of all, I want to just applaud Marcus and Jordan for sharing your stories. I have 2 sisters who are 12 and 13, and so I'm listening to this from 2 point of views. One, as an older sister who's concerned about, my little sisters who are in middle school and what they're going through, and then also my own personal experience. I developed an anxiety disorder when I was 14 years old, and at the time there was no conversation for mental health. Self-care wasn't a term that people used, and so when I reached out for help, I felt very isolated and very alone, and I leaned on my parents a lot, and I came to them and said, hey, I'm not feeling well. I'm not feeling like I want to go to school. And this is a red flag to me. And I developed such a strong relationship to my therapist. I've had the same therapist since I was 14. I'm 27 now. And so I've had a really positive experience just reaching out and asking for help. And then also just speaking vocally about my own struggle, which is what Jordan and Marcus are doing. And it's just like, I was tearing up over here, just so proud of the both of you.
And just to jump in, by having these conversations and hearing stories like from Jordan and Marcus, it normalizes the eternal experience that so many young people have had over the past year. So putting it on writing is a way to further reach all of these kids who feel like they're alone.
Someone said the kids are not okay. And I have to say, overall, that is not okay. I want to bring in John, who as an adult, with interacting with so many young people, you're a principal at Sierra Vista. And I just have to note that there have been 2 reports of death by suicide here in New York City among middle schoolers in the last 2 months. And I feel like I can't help but think that is an early warning sign that there is a lot not okay right now. And I know that you, John, had 6 students attempt suicide during the lockdown. John, can you tell us about sort of this heartbreaking trend and what steps you've taken to try to fight it?
Absolutely. Thank you so much for having me and my amazing student, Jordan, Marcus, Asia. I couldn't be more proud of you, Jordan, and you sharing your story. And I think that's the number one thing is going into next year. I know we think we've had a difficult year this year, but as students return next year, I think we're up for an even bigger challenge. As a principal, my job was always content and making sure that our kids walk across that stage. And very quickly, it's become a mental health counselor. It's become so many other things outside of the curriculum. And so we have to be prepared, I think, as principals, as teachers, as educators in the fall and beyond, that students are going to be bringing with them so many challenges that they face throughout this time. And we have to provide the forum for our kids to speak. We've been very, very fortunate. Even before the pandemic, we had started working with the JED Foundation out of New York City, and they've trained our educators, they've trained our teachers for signs and things to look for. And we actually saw a decline before the pandemic, and we felt that things we were doing at our school were really helping. And then, of course, the pandemic hit, and we saw this rise again in suicide ideation and attempts. And so the red flags went up immediately. And so I'm hoping that we'll be able to provide our teachers, our administrators, our counselors, our social workers with the tools they need. But like I said, to be ready to take on more challenges that the kids are going to bring with them. Going back to what Marcus said, the society changes and challenges and protest and all of these things that they're watching and listening to. Are we going to be prepared to have them voice their feelings? And then how do we respond with an open mind and an open ear? Many of our teachers have not been trained in that way. So we have to do our best as adults, because I'll tell you, our kids need us and they need us now. And we have to be ready for that. Even if we have to put the content aside for just a bit and focus on the mental health first, then we're willing to do that. So one of the things that we started here at our school is SV, Sierra Vista Speaks, which gives our kids a forum to come together and really talk about any issues they want. It doesn't have to be suicide. It could be racial relations. It could be oppression. It could be so many different things. And you'd be surprised how those conversations evolve into so many amazing topics. Another thing that we've done in Clark County, and it was mentioned in the New York Times piece, is the partnership with Panorama and Beacon, to where all of our students are now surveyed periodically throughout the year. And because of the survey and the way it's worded, we can see red flags pop up well before we get to a traumatic event. And we've never done that before. We've always been so reactionary. And now I feel like because of this partnership, we're now proactive and getting to our kids at the foundational level of their mental health rather than when it's too late.
I'm curious if some of the other experts can jump in, because, I've done stories about how for the last year, because students haven't been going into school, that teachers have not had their eyes, and counselors and the cafeteria workers have not had eyes on children. And I'm wondering, if John's idea of this survey can be scalable, as the people in Google and YouTube world would say. How do you make sure that can be, accessed across the country? And also, Christine Archna, jump in.
Yeah. So, I was just going to say, I think what Mr. Anzalone is highlighting is in part a need to think about prevention and early intervention models. We know that, we have significant evidence now and a lot of data to show that mental health, especially for young people, is being disproportionately affected. So planning and scaling efforts such as ongoing monitoring and making tools widely accessible, whether it's digital tools that we talked about before, normalizing conversations that might be affecting teens and young people in schools, or even frankly as part of routine, pediatric visits, like routine healthcare checkups, like bringing away that sort of barrier and the stigma that's often associated. And early intervention, I think, is actually really, really important. But part of that for me is actually hearing from the youth themselves. And, speaking to what others have said, I knew that we would have students on our panel today and young NAMI ambassadors, but I have to tell you all who are watching, I didn't know what you were going to say. And it took me, you really blew me away, Jordan and Marcus, thank you so much. And in each of your stories, you are not only sharing your lived experience, but also ways in which you have managed to cope and reached out for help by talking to trusted adults, which I highly, highly recommend, reaching out to your friends. But I have to say, one of the simplest things that you're doing, despite all of the distress that young people have experienced and are experiencing, you're not disengaged. You stay connected. And actually, when I think about really some of the most important issues in society, whether it's climate crisis, issues of health equity and racial justice, in every single area, young people have kept the conversation alive. They have been advocates for themselves. And sometimes it's simply by asking why. Why are we doing things this way? And can we imagine a different way of doing it? And I think that's really, really critical, to have spaces where we can hear from them and to intervene early. Christine, would you like to add to that?
Another thing that I'd like to add is that entering the fall, it's going to be a really stressful time for our young people because a number of kids have decided to continue remote learning. But when the fall comes, everyone, for the most part, will most likely go back to school. And that's probably going to bring up a lot of strong emotions from some kids, feeling anxious, feeling more depressed. And when they're in the classroom setting, there is a tendency to compare yourself to your peers around you. Oh, it looks like so-and-so is really coping and dealing with this transition really well. Why do I have so much anxiety? So I think it's critical for us to continue to have these conversations now and throughout the summer to prepare our students for going back into the classroom, to let them know that it may be a difficult transition, and for schools to have supports in place very early on in the school year to make it such that our young people are able to succeed and thrive when they're back in the school environment.
Absolutely. And I think it brings in an audience question that came up. It was posted by Steve in the audience. He said, do you feel that with less face-to-face time with peers, it creates even more reliance on social media? And if so, how can we address the detrimental impact that social media has on youth? And Asia, I'd be curious what you think about that and as well as our clinicians.
Yeah, absolutely. I mean, I think that that's a huge part of it. And even before entering the classroom, that comparing yourself to others, to even people that you don't even know, exists every day, constantly, I think, for all of us on social media. For me, much of my own story with bullying existed online, and that was before a pandemic. So I can't even imagine what it's like today. Whenever I speak to young people, I always say that you have to put yourself and your mental health and well-being first. And if that means taking time off of social media, deleting the app, or just logging off, or making sure you're using whatever tools those platforms give you, whether it is privacy settings or blocking and reporting, you have to take care of yourself first. And social media is not going away. It'll be there. But I think it can have an impact that a lot of us are not even aware of until it affects us at that level and we are dealing with that everyday depression and anxiety.
Corinne, I want to bring you in. As an Asian American, I have been reporting on the rise in hate crimes against Asian Americans, and I know that I've had conversations with my children about it. There are surveys that say some Asian American kids don't want to go to class because they fear that kind of bullying. I wonder if you can talk about the difficulty of acknowledging mental illness in the Black community and also this sort of awareness that African Americans have now in this conversation of racial strife.
Yeah, I mean, I can talk to my own experience, just everything that happened over the summer, and just this kind of catch-22 of wanting to be so mobilized and involved in everything that was going on, but then also being aware of the mental health effects that I was experiencing, from the news and just the constant struggles that the Black community was going through. And I will also say that there's a lot of stigma still in the Black community about asking for help, about talking about your mental health issues. And at least for me, when I came to my family and said, hey, I'm not feeling well, I'm feeling anxious, the first response was, hey, we don't talk about that. And then I, through pushing my family and saying, hey, no, I want to talk about this, started to break down their own barriers to what they were even experiencing or what they had experienced in the past. And so I think sometimes we have to push outside of what's comfortable and have these conversations that maybe our parents hadn't had before or our grandparents hadn't had before. And it takes a lot of strength to do that. But once we opened up that conversation, there was so much connection and so much understanding. And a lot of what I was feeling, I learned my parents had felt before. And that was really comforting for me.
It's so important to break through that stigma, because on the other side of that stigma is treatment. Yeah. And so if you don't break through that, that makes it all the more difficult. Asia, I know that when it comes to different cultures, there's a bigger picture at play here, because hate often manifests as bullying, at least in the kids' world, right? What advice would you give to young people who are experiencing bullying? And Jordan, Marcus, feel free to jump in on this as well.
Yeah, I think that at least in my own story with bullying, I thought that it was my fault and I didn't talk about it. And then it just kind of snowballed after 8 years. And that is when I started feeling the mental health repercussions of it. And so whenever I speak to young people, I always say that you have to find people in your life to talk to and ask for help, even if it takes a lot of time, even if it doesn't work immediately. You have to continue trying to be your own advocate. And I know how hard it is, but don't give up on yourself. And one thing I always like to say is when you're feeling not at your worst, make a list of the top 5 adults in your life that you trust, whoever they might be. Keep it with you at all times and write down some tactics as to how you might want to talk to them. Because I think that when you're at your worst place, it can be really hard to communicate and to think of the people that do care about you and that are there. And so having that with you at all times, I think, is really important. But I would love to hear from Marcus and Jordan that are living it now.
Especially, that's such good advice. Yeah, Jordan, Marcus, what do you think about the idea of getting help?
I would have to agree with that. Frankly, because I just got out of middle school just a few years ago, I'm like more, social media played a big role in that too. The rise of it, like Instagram and at the time Vine and stuff, you just had to be in like this social structure of being popular and how many followers do you have? I mean, it's still like that today, but at the time in middle school, everyone wants to be that person. And frankly, it's hard to, especially during middle school, to say, just get over it. Like, it's going to be over soon. It's not that big of a deal. Everyone goes through this awkward stage that they like to say during middle school. And honestly, if we're going to talk about an awkward stage, why was my awkward stage literally being told by people that I was ugly and that I wasn't smart? Like, that's not an awkward stage. That's straight up bullying, and that's harming someone. And the thing is, people don't realize that. They say it's kid nature. There is no such thing. Bullying is bullying, like, no matter what. And I think that needs to be recognized first before we even think about helping these kids, because how are we going to help them if you don't realize the problem? And that was the thing with me. I reached out to my counselor, my 6th grade counselor, and I was like, I'm getting bullied really bad. No one's helping me that much. And she was like, oh, it's fine. And at the time I was like, okay, I'm overreacting, until I told my close friend's parent, and I was like, I'm not doing okay. And I realized that my mental health was just crushed. I was already going through so much stuff outside of school that within school, it was like, wow, you really can't get help. So I recommend for every child that if you feel the slightest bit of bullying, if you feel like you're not okay, you reach out to someone, because no matter how hard you have to reach out to them, be like, no, I'm getting bullied. If you have to go every single day, go every single day, because that's a serious matter. And if not, you go tell your mom. And coming from a Black household, it was kind of embarrassing, like, at the time, because you're not really told to express your emotions like that. But I grew up like this, so I had to adapt. I was like, Mom, like, this is how I am, and just don't feel any, you shouldn't be ashamed of it. It's really something that is normal and should be normalized every single day. So.
And your experience, doubles down on why Asia said pick 5 grown-ups, right? If you don't get the right answer from the first grown-up, go to the second and the third and the fourth and the fifth, because you deserve to be heard and action can be taken. Marcus, how about you on this subject? Sure, go ahead, Christine.
As adults, it is incredibly important that we validate the experiences of our young people when they come to us and they share with us that they're struggling, that they're stressed, that they're sad, so that we don't have a situation like Jordan had just described, in which you're just giving out messages of, you'll be okay, it's not a big deal. It's so incredible. It's so important that we validate their experiences.
And yeah, Christine, on that point, it's amazing to recognize the leadership the young folks on this conversation are taking. I mean, you all should be so proud of yourselves. Your ability to destigmatize this conversation, tell your story, and have people understand that that's their story as well, is incredibly powerful. And it's just for me to just be a part of this and see their ability to articulate their lives in such a powerful manner.
Absolutely. Marcus.
I think that it's incredibly, there's so many variables to bullying and why people feel the way that they feel in our generation. And I think that social media plays a leading role in that. Kind of what Jordan and Asia kind of touched on. They pretty much hit it on the mark when they said to reach out to adults that you trust, and kind of that repetition of constantly asking for help, I think is a good thing. And in terms of thinking that it's your fault, you should never think that it's your fault. And I encourage you to not think so. And although it can be hard and it's easier said than done, but one of the things that my mentor always told me was that hurt people hurt people. And so I think that bullying comes from it comes from many different products of many different variables in someone's life. So someone could be getting bullied, go to someone for help, not receive that help, and take those emotions and frustration out on others, which become a domino effect.
Marcus, you're giving, graduate school level advice here on how to handle these situations. I want to bring in our, the folks at Chan School of Public Health are keeping an eye on you, young man. I want to bring in our wall of expert young people. They are brimming with questions, so I want to bring them in. I want to start with 16-year-old Michelle Yang, who has our first question.
Thank you, Juju. My question is, the aggression towards Asian Americans has increased so much in this year in my community. One of my friends was bullied for her appearance, and they specifically targeted her Asian features on her face. What are ways to help her and all of us cope?
Archana, maybe you can take that one.
Yeah, I think sadly these stories, as we're hearing over and over again, are all too common. And it is important, whether as teachers, as healthcare providers, in all community settings where there are young people and families, that we are prepared to respond to this. And I think part of it is acknowledging and naming the problem, that this is real. We can't be dismissive of it. And I think the second thing is to build safe spaces where, we can talk about it together, to build a sense of connection and support. There are certainly, I know in schools, for example, policies and discussions around, the types of bullying and discriminatory behaviors, identifying them, making sure they're not tolerated. But I think ultimately the idea is we are really trying to build communities to connect with each other, because this is going to take some time. And while we are struggling through it, we need a lot of support together as a community. So I think there are things that we can do to connect together as young people, but there's the responsibility in terms of thinking about how we respond as teachers, as caregivers, like a systems response is really, really critical, to not put the onus only on young people.
Absolutely. And yet allyship in all of those forms is incredibly important in the face of bullying. Archana, thank you. Next, we have 15-year-old Soleil. Take it away.
So what will be the what will be the long-term effects on all of us going through this?
Christine?
That is a phenomenal question. And I think a lot of folks are wondering about the long-term effects as well, because this is the first time in a lot of people's lifetimes in which childhood and typical child development milestones have been so impacted by this disruption that was caused by the pandemic. And so one thing that we may see in some of our young people who've had to endure this past year is a sense of resiliency, because you've really been challenged by this past year. You've experienced a significant amount of loss. And as a result, you've had to quickly identify various tools and strategies to be able to cope and deal with these stressors. And so what I'm hopeful for is that moving forward, young people have now acquired all of these tools such that when they're faced with challenges in the future, they can be more resilient. They can also know the importance of talking about their mental health because of conversations like this, normalizing the importance of talking about anxiety and depression, that perhaps in the future, they'll be more likely to have these conversations as well. And so I know it's very easy to kind of think about the negative impact that this can have on our young people, but I want to look at the silver lining and look at the fact that resiliency has been built over this this period of time. And also, I feel as though we all have a greater sense of empathy for each other, for all of the wide range of emotions that we experience, the wide range of reactions that we have to stress. And so I hope that young people will have a better understanding of how it feels to be anxious and depressed.
I'm just going to tag on to what Christine said real quick to say, just agreeing with what you're saying, Christine, and to add what, I think part of the onus again is on, those people who care for kids, whether it's caregivers, families, parents, teachers. And one of the things that I think we really need is systemic change, thinking about policies that can support school systems, ways of making mental health care more accessible. Essentially, anything that is a systemic response that supports children, I think will pave that way to resiliency. So I think there are things we can all do individually, and how we sort of rise to this occasion as a society is also important. I mean, we have such well-documented, even prior to the pandemic, data showing that mental health care is not accessible, that we need to scale up, that we need to have more mental health resources in school-based settings, which is actually where many students access, and it's their only point of contact for mental health care. So I think part of the answer is in folks normalizing the conversation and asking for help and tools to build that sense of resilience. And part of it is how we as a society rise up to meet this need and respond to the children. So I would say to all the young people, please keep asking and please keep advocating.
Right. And just like in the conversation about being brave, it doesn't mean that you're not afraid. You're sort of brave despite your fears.
Absolutely.
And you can be resilient, and you don't always have to be strong. You can be vulnerable and yet still be resilient. So our next question comes up from 14-year-old Roman.
Hi, thank you for your time. So my question is, if I'm witnessing one of my friends building up a mental health issue, and they don't yet realize it, what should I do?
Great question. Go ahead.
I was just going to clarify. The question is, you've noticed you have some concerns about your friends struggling. Is that right?
Yes. And I think Garth can jump in too. It's this idea that, you could go on YouTube and look for information and on how to manage stress too.
Yeah. The thing I would say, and I'm sure Christine and others would say is, if pointing them to resources and showing them potentially ways in which they may want to engage and think about their getting help is really important. But also making everything you heard the young folks here, your other peers say today is having them feel like, they're not alone, that this isn't something that they have to struggle on their own with, that there's a support system. They should reach out to parents, reach out to people that they trust, and then pointing to those resources that we articulated earlier, I think is particularly important.
The one point that I'll also add to that is that I don't want kids to feel like they have to hold on to the burden of other people and feel as though they're alone and trying to figure out how best to support their friend. That's something we do not want to have at all. And so I'm appreciative that you've asked this question because it shows that you're a great friend. And so if a friend is sharing with you difficult things that they're going through, reaching out to other adults, other people who you feel safe with to share this information is critical, because we wouldn't want you to sit with all of those difficult emotions, because that can have an impact on your mental health as well. So it can be too much to carry on your two shoulders alone. And so having a team of support around you to help your friend out can be the most beneficial way to give that friend support.
That's fabulous advice. And let's hear now from 15-year-old Aiden, who has a question.
Well, on the note of getting information from YouTube videos, there's so many options. How do you choose the best one, find the best information?
Oh, that's a great question. Firstly, you want to make sure, and that's what we do. It's very important for us to surface the right kinds of scientific information that is going to resonate with you. And what I often say to folks is, find that scientific, that source, that resource that feels engaging to you, that feels like it's somebody who's speaking to you, because then you're more likely to feel like that person is a part of your story. But it's important for us that information be scientifically sound, evidence-based, and particularly engaging so that it speaks to your problems. And to Christine's earlier point, these resources are one component of this. We also want you to think about your parents and colleagues as resources. And we don't want you to always think that you have to shoulder the burden of figuring it all out on your own, but being able to look to responsible other resources to be able to help you on your journey.
We are closing in on the end. I cannot believe how quickly we're getting through all of this. I just wanted to thank everyone for their time, for joining us in what I know for many of us feels like a year-long marathon Zoom session. So for you to pick to be here today and choose this to be the way you spend your time says so much about your priorities. I know that we've learned so much in the last conversation about mental health, but I want to give each of our folks, from Garth to Christine to Archana and Corinne and Asia, thoughts on what your takeaway would be for the folks who've joined us today. Garth, let me start with you.
Hopeful. I think my takeaway is hearing from some of the things I've heard, so particularly the Jordan and others, and what Corinne said, and all those things make me hopeful that we are taking on changing the culture and institutions that have made it challenging for us to seek care, and now we are looking to a new future. And I think this is the leadership we have in front of us, in Corinne, Jordan, and others, that I think is going to make a difference and make our world a better place.
Archana?
You sort of took the thing that I wanted to say, Garth. But I am going to say, thank you for, keeping this conversation going, for sharing your lived experiences, also highlighting the challenges when you do seek help, but your sort of persistence in continuing to connect with the community of supporters, which may include mental health professionals, but also, friends and trusted adults. I really do think that, as I said, sometimes just asking why and asking us to imagine doing things differently. This is I would say, a time when it's not just a moment, but the start of a important movement of changes. And I think we would do well to listen to you. So thank you.
And John, educators are such important partners in this issue. Closing thoughts?
Absolutely. Again, thank you so much for the time and for having our students on. This is a great opportunity. We have the American Recovery money coming in, and many of our large urban districts like ours are receiving a lot of money. And I'm really hopeful and I'm praying that principals and superintendents all around the country will take advantage of these funds. This is potentially a once in a lifetime bucket of money. I'm hoping that so much of it will go towards mental health, bringing in more social workers and counselors and resources to our kids in our schools. And that would just be my hope for American education, is to not let this opportunity go to waste, and to take advantage of this time.
And Jordan, Marcus, I want to get your closing thoughts before we say goodbye to you as well. Jordan, let's start with you.
I really just want to just throw it out. Many kids believe that since they're kids that they don't have a voice, and you do have a voice. This is your life. We're the next generation, and we need to show that we do matter and that mental health matters. And that's really what I want to throw across. So your voice does matter.
Marcus, you're unmuted, but we hear you both loud and clear. Go ahead.
I'm really geared toward not only this being, as I mentioned before, there are many variables in mental health and coming to seek help, and then that being a cause of detrimental effects to that individual that may lead to bigger problems than it initially was. So I'm big on it being a team-oriented resolution or solution, so that all of us will be responsible for trying to resolve the mental health crisis that we are all experiencing in our day-to-day lives. And it starts with us, it starts with you, it starts with all the viewers and participants. So I want to say thank you for this opportunity as well. It's an honor to be here.
I have to say it's bittersweet, because I think it's a shame that you had to go through such struggle to make you wise beyond your years, but you are clearly thus. And so I am deeply proud of both of you, Jordan and Marcus, and of course, everyone on this panel. But my final thoughts are going to go to our fabulous NAMI ambassadors. So Asia, Corinne, I'll let you guys take it away. Whoever wants to start.
I'll go, but I will just say that even though I'm an ambassador for mental health, I was taking notes myself. Just because, like I said, I have two sisters who are 12 and 13 who are going through this right now. And my experience at 14, which was 13 years ago, is so different than what they're living right now. And I think just staying informed as a part of my sister's tribe, informed on what they're going through, informed on what their unique challenges are, so that I can be a resource to them. And like what Marcus said, I mean, it takes a tribe, it takes a village to address this mental health crisis, from teachers to doctors to experts to family members, to your friend groups. We all have to be informed, be motivated, and have our tools so that we can support the ones we love and even ourselves, and know how to ask for help. And so it was, for me, even just being a part of this was so informative, so that I can now go and bring this to my two little sisters, so we can have a nice sit-down conversation before school starts in the fall. And I want to hear what they're going through. And so I just feel thankful to be here. And I'm so inspired too by Jordan and Marcus, and I was crying half the time. So you guys are absolutely incredible.
Well, the fact that you're taking notes is precisely why you're the brand ambassador, because you are learning, as we all are, every day. Asia, final thoughts.
Yeah, I just want to thank all of you for having this conversation, and especially to Marcus and Jordan for sharing something that is so personal and vulnerable, and I'm sure scary. I think that when young people, especially who are going through it, speak out at a level like this, that is how there will be change in schools and communities and everywhere. And so thank you for your bravery, and thank you all for hosting this.
Well, I am so pleased and honored to be here. I too learned so much, and I'm so grateful to Dean Williams and to Dan Gillison and to everyone on this panel, and to that glorious wall of young people that we've had questions from. As we know, this is an incredibly vital conversation that we're having, and we hope to spread the word far and wide. Thanks to Garth Graham and the folks at Google Health and YouTube. Thanks obviously to NAMI, and absolutely we'll walk away with so many lessons from each and every one of you. So thank you so much for taking part in this excellent convening. I hope you all engage in some self-care throughout the balance of the day, and be well.